I've always been like a team player. It's just the way that I kind of grew up, family dynamics, and also from just playing organized sports from elementary school all the way through college. So it's just always a thing that I am. Like, for example, I'm the guy that wakes up butt crack early to go to the park to get the best spot for the picnic. Or the guy that, when I worked at Staples growing up, was volunteer to switch shifts with coworkers just to accommodate them and make everybody comfortable and happy. Or the guy that, you know, set up a system with the neighbors to combat that damn alternate side parking. So that's just one thing that has always carried me and just taught me to kind of like um, complete projects, be social, and it was just a skill that carried me throughout. I was undecided when I went to college. I didn't really know what I wanted to study, but I was there. I would show up to class all the time. And after junior year, it was time to just declare a major. So I decided psychology. This is what I want to do. This is it. So I was taking classes and learning about all the different types of psychology and all the different fields. And I started to learn that I was becoming fascinated with research and the process of it. You know, the lit review, the methodology, the developing of tools to collect data, the analyzing of data, the interpretation of the data. It just fascinated me. So I was set. I was like, this is what I want to do. And the icing of the cake was going to the Eastern Psychology Association to present my senior thesis. So I was set. I was like, this is what I want to do. This is it. So I graduated college, and you know, like most college grads, you don't know what kind of job you're gonna get. You just got to get a job. So I started finding myself in a lot of direct care work. I was working as a case manager for a home-based crisis intervention program, or as a teacher's assistant in a therapeutic community in a foster care residential program. So those were the kind of jobs that I was getting, and I started to notice that if I want to do this research, I need some more school. So I went back to grad school, and I armed myself with the importance of statistical significance and learned about T-squares. And I was just ready to go out there and do more research. So I had found a job in a city agency where that was one of the main things that they did, research. So for the first year, I was just there learning and trying to learn about different standards and different ways to provide oversight, because the agency that I worked at provided oversight for different types of mental health programs, behavioral health, addictions, housing programs, prison reentry programs. So those were the types of things that I was evaluating and reviewing. So right around this time was around the time that then Mayor Bloomberg, came out with the food standards, New York City food standards. I don't know if you heard about the New York City food standards, but if you ever go to McDonald's and you see the number of calories next to the menu, that's one of the reasons why. So if you see a Big Mac and you see 563 next to it, that's how many calories are in it. So when it came to city agencies that were receiving money from the city to provide services, they had an extra 120 set of standards that they had to follow. For example, if a program purchased food, there was a set of standards for that. If a program served food, there was a set of standards for that. If they purchased a can of tuna, the can of tuna had to be less than 290 milligrams of sodium. Or if they purchased a cereal, it had to be less than 215 grams of sugar, less than 6 grams of sugar, I'm sorry. So the options for the participants wasn't the most healthy. They all complained about it. But the main point of the food standards was to provide food that had less added sugar and lower sodium in order to reduce incidences of obesity and high blood pressure, amongst other health disorders that could happen because of bad diet. So one day, I'm sitting in a staff meeting, and our assistant program director who looked like Woody Allen and wore a extra baggy suit, like the suit was extra big on him. He gets up there and says, "We've been commissioned by the mayor's office. We have to come up with a report to measure the impact of the food standards and how the city agencies are complying with it." So I looked around the room, and I was part of a multidisciplinary team that consisted of MDs, it consisted of PhDs, consisted of MBAs, it consisted of social workers, nurse practitioners. It was about 23 different people, different practices, disciplines in the room. I look to the left where the MDs are, and I see one, she's doodling flowers. The other is playing Sudoku. I look to my right, I look at the PhDs. They're looking at each other, like making a face like, don't volunteer, don't do it. I look to the end of the table, I see the social workers. They're not even paying attention. They were somewhere else. So I kind of slowly start to raise my hand, and I say, this is my chance. Like, you know, I got some stuff I could do here. So I say, I'll do it. I'll do it. So Dr. T says, great, stop by my office and we can discuss the particulars. But I think you're gonna need a colleague to help you out. So I said, okay. I looked around the room and I already knew nobody was really interested, so I was in for one. So the next day, I was able to convince Dr. N, who sat 2 doors down from me, to help me out. And I was able to convince her by saying that I will do her housing and apartment inspection visits all the way out in Brooklyn, the last stop on the A train. So that was gonna be a long trip, but I was able to convince her. I said I was gonna do 15 of them. So we go to Dr. T's office and we sit there and he's like, this is a list of 622 programs that we have to review and evaluate. What do you think we should do? And in my brain, I'm already going, oh, you know, we got surveys, we got online surveys, we can do this, we can do that. I'm thinking SPSS, I'm thinking about coding. It's just going through my brain, everything that we think we should do. So I start to kind of rattle off a plan of what we should do. And he's like, that sounds great. Here you go. We'll talk soon. So I was like, all right, we're out of here. So we, at first, like I would meet with Dr. T, we would meet with Dr. T like every 3 months. And every time we would meet, we would rattle off how many programs we chopped off the list. Oh, we're down to 498 now. 3 months later, oh, it's about 320. 3 months later, we're down to about 47. And at this time, he's already getting a little anxious, I guess. And he's like, we need to meet more often. I need more updates. And he's constantly asking daily updates of 46, 45, 43, 30. And at one point, he says to us, well, we have a deadline of July 1st for this project, so why don't you put something on my desk by June 23rd? I was like, great. I'm writing up my summary. I'm punching in numbers, 1, coding 0, 0. I'm going crazy just on the computer, 0, 1, getting this done. So I write up my summary. We write up our summary. We get our findings. We get it into him, type up the report by Dr. T, by Dr. N, and by Louis Melo. Hand it into him, great. A few days go by, I'm feeling great. I'm like, we just finished this awesome food standards project. This is gonna be great. I think it was a Tuesday afternoon, I ran into an old colleague who used to sit in our office, actually, and he now moved on to the mayor's office. And he knew that we were working on some food standards, but he was always a jokester. He would tell me, hey, we got the report on the food that you guys sent over. It was awesome, but I didn't see your name on it. So I'm thinking, this guy's messing with me. He's always messing around. I'm like, get the F out of here. You messing around, so don't mess around. He's like, no, seriously, I didn't see your name on it. So I thought he was joking, so I just kind of walked off and just went to my desk, thought he was playing. But there's something in my brain that said, you know, check that out for yourself. So I went into my computer, checked my emails, and I didn't see anything that said I was included in a message to the mayor's office. So So I was like, maybe he was telling the truth. Maybe I wasn't included on that. So I built up the courage and I went to Dr. T's office and I said, hey, I heard that the mayor's office got the report. Do you mind sending it to me? He said, sure, no problem. He sent it over to me. I rushed over to my desk, opened it up. Sure, the guy was right. My name wasn't on it. I was shocked. I couldn't believe it. I was like, what just happened? Like, we just spent the last 9 months working on this, and why isn't my name on it? Why isn't Dr. N's name on it? Does she know? Let me go tell her. So I go over to her office. She's in there jamming to Mary J. And, I tell her, I'm like, hey, I don't know if you saw this, but our names is not on this. She looked at it, and she wasn't as upset as I was, and she wasn't shocked. And what she told me was, it's not a big deal. You got to pick your battles in this place, and I don't think that it's a battle I want to have right now. I looked at her, and I said, are you serious? You going to let them play us like that? Like, our name's not on this. Like, we did this work. Like, we did it. He didn't do it. We did the work. He just had minor feedback for it. But she was like, it's okay. There'll be other opportunities for you to get your name on a report to the mayor's office. So just live with it. And I was like, all right. I kind of was a little dejected and frustrated and walked back to my desk. And I was like, this can't be right. This can't be right. I'm looking left, I'm looking right, I'm looking up, I'm looking down. I'm just kind of doubting, like, just the work that I just did. Like, what would happen? Like, what's going on? But something inside of me told me, no, this is not right. You have to do something about it. And at that moment, I got up and I marched down to Dr. T's office. And if you've ever been in a city building, in one of those old city buildings, they're old, they got the bricks, tall doors. I'm marching through them. Like, it didn't even faze me. I'm like 6'4", it didn't even faze me. I'm walking through, smelling the dust, nothing. I get to this door and I start to bang on it, bam, 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 bam. He wasn't there. Bang on it again, bam, 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 bam. He wasn't there. He shared the office with the director of the program, and she heard me. So she came out of her office like, what's this loud noise? And she's like, Louis, is everything all right? And I'm like, yeah, kinda. But she noticed that something wasn't right with me because she knew me. She saw my face and she thought I was like a little upset. She's like, what's going on? Are you sure everything's all right? And I'm like, yeah. And I had the report in my hand. I'm like, yeah, we worked on this report and it went to the mayor's office and my name's not on it. And she goes to me, really? Let me take a look at that. I saw this report. It was a really good job. And she's like, yeah, you're right. Your name is not on it. This is not right. And then right when she said that, Dr. T just happened to pop up. Like, he just walked right through the door. And we both looked at the same time. And she said, hey, Dr. T, come over. We have something to discuss with you because Louis is over here. He has some questions about this report. So he comes down, sits down, and he's like, what's going on? And I say to him, I'm like, yeah, I got the report that you sent over to me earlier, and I noticed that my name wasn't on it, and I just wanted to know why. And he said, oh, your name's going to go on it. It's supposed to be on it. I'm just going some back and forth, some edits going back and forth with the mayor's office, some things I got to tidy up. But it's supposed to be there. I thought to myself, yeah, all right. You didn't even mean that. So I looked at the director, and she said, just let's make sure everybody gets the credit they deserve for this project. So she kind of diffused the situation. I walked out, went back to my office. She went back to her office. Dr. T went back to his office. And a few days went by, and I kind of stopped thinking about it. I was like, I'm getting played. This is messed up. But I came to my desk, and I opened up my email. And I don't know about your job, but my job sends like email broadcasts about everything happening in the agency. Sometimes you just ignore those emails. You don't even read them. You're just like, whatever. But that day, the email came up, and what did I see? It said, the first thing that popped up, it said New York City food standards for meals and snacks served. And right under it, Louis Melo, Dr. T, Dr. N. And I was like, what? My mom made it. I was pumped. I was pumped. But then I had a moment to kind of reflect, and my takeaway from it was that there's gonna be moments of doubt, but your skills and your ability put into action is gonna outweigh the doubt. So don't be afraid to stand up for yourself and the work that you do. Thank you.